And are these, Ted, are these live?
Yeah. We just remind the task force members that they are live. They want to talk over someone. Yeah.
Good afternoon. Welcome to the Intellectual and Developmental Disability Task Force public comment portion before our public meeting, which will begin at 2 o'clock. And so we always, before our meetings, when there is a need, we have public comment. And so I believe we have 3 people that have signed up to testify. Is there anyone that did not sign up that would like to testify? All right, so we have 3. Normally we have a 2-minute limit because if we have a lot of people, we want to be sure everyone gets to comment. But with there being only 3 people that have signed up, we aren't going to limit you, provided we ask that you not be repetitive, that you keep your comments that you share with us new. But with that being said, if we have someone that would like, do we have the first person?
Chris Kirk.
Chris Kirk, if you could identify yourself and then who you're with.
My name is Chris Kirk. I'm with Little Star ABA Therapy, and we're all over the state of Indiana. Am I supposed to give my address, I believe, as well? It said on there? Or? Okay. Hello, and thank you for the opportunity to speak with you today about a pressing issue that impacts the lives of more than 6,000 Hoosier children and their families. I appreciate the efforts of the Intellectual and Developmental Disabilities Task Force and their commitment to bringing this important issue to the forefront of your attention. My name is Chris Kirk, and I work at Little Star, a nonprofit provider of applied behavior analysis, or ABA therapy, in Indiana. I'm also a board member for a provider organization called INPEAT. Today, I want to emphasize the critical importance of increasing the proposed Medicaid reimbursement rates for autism services in Indiana to ensure that Hoosiers with autism can still receive the transformative services they depend on to help them live more fulfilled lives. ABA therapy is an evidence-based, scientifically validated medical treatment endorsed by the U.S. Surgeon General and the American Academy of Pediatrics as the preferred treatment for children with autism. It is crucial that children access ABA as early as possible, exponentially increasing their opportunities to improve their social, cognitive, and behavioral trajectories. ABA therapy plays a critical role in teaching children, as well as their caregivers, the necessary skills to navigate their surroundings, including valuable life skills many of us take for granted, giving them more autonomy as they grow into adulthood. Indiana Medicaid's plan to cut rates to below provider operating costs is troubling and deeply concerning. If these rates are implemented, ABA therapy providers across our state will be forced to either close their operations or reevaluate serving families relying on Medicaid to cover services. This would have a devastating impact on thousands of Hoosier children with autism who rely on these services for essential support and development. It is essential to recognize that the majority of ABA therapy services in Indiana are delivered through professionally managed and staffed therapy centers, which provide structured environments, trained supervisors, and board-certified behavior analysts to support our patients. The center-based model offers daily treatment for approximately 20 to 40 hours per week, enhancing patient outcomes significantly. The rates proposed by Indiana FSSA's Office of Medicaid Policy and Planning on September 20th are still below the current provider operating costs, even when adjusted for inflation. To be a good partner for the state and our patients, Little Star has not changed our rates while Medicaid reviewed implementing a fee schedule. Since COVID, our costs have increased dramatically, from everyday items to keep our centers open, our rent, and our payroll. The state increased the program cost from 15 to 20% through the rate negotiations, which unfortunately is still below where it needs to be. The statewide median for program costs right now is at 42.5%, and to close the gap, the INPEAT board asked Medicaid on September 19th to consider a 30% program cost, which would put the rate at $76 an hour for direct services with a registered therapist. Little Star is a nonprofit organization, and in order to keep serving our patients and their families, we must bring in enough revenue to cover operational and administrative costs. We want to make sure that other ABA providers can continue to offer services and provide for their patients. Our proposed $76 rate is a win for the state, as it is well below the average of $91 an hour, or the updated average, which is $97. However, the proposed rate from the state is below the cost survey that was done a year and a half to 2 years ago. If this lower rate schedule is implemented, we'll see a guaranteed reduction in availability and quality of ABA therapy services, ultimately harming the children and families who depend on them. Indiana providers acknowledge the importance of fiscal responsibility and support the process of switching to a fair and sustainable fixed rate fee schedule. However, cutting access to recommended and necessary ABA therapy services will result in higher costs for Indiana Medicaid long-term. An important goal of this task force is to help people with disabilities find employment. This aligns with the broader workforce initiatives that have been a priority for this administration. In fact, there are over 135,000 unfilled jobs in Indiana today, and nearly 85% of people with autism are unemployed. Providing ABA therapy, especially in the critical early years for a patient, has been proven to result in better outcomes and greater independence long-term. ABA therapy is a vital tool in closing the gap and helping equip children with autism with the tools they need to join the workforce as they become adults. Ladies and gentlemen, the revised rate proposed by FSSA remains a significant and debilitating cut. It will lead to reduced services, center closures, and therapy deserts. Temporary cost savings do not outweigh the clear benefit of ABA therapy, nor will they prevent long-term stresses on the Medicaid system. We believe that a fair, transparent rate agreement can be reached that benefits all stakeholders, maintains access to vital ABA therapy services, and ultimately results in a fiscally responsible long-term plan for Medicaid. We need your help in asking the governor to reconsider this proposal so we as ABA therapy providers can maintain the quality of care that our children deserve and save Indiana taxpayers future dollars. Thank you for your attention, and we look forward to working with you to find a solution that ensures the well-being of our Hoosier children with autism. Thank you.
Questions? Does Little Star operate in states other than Indiana?
No, we're just in Indiana.
Indiana.
Yeah. Oh, we don't have a center in Kentucky, but yeah, but our entire base is here.
Any questions?
Thank you.
Mary?
Hello, good afternoon. I appreciate the opportunity to be here. My name is Mary Rossworm, and I stand before you as the CEO of Little Star ABA Therapy and a mother of an adult. I was going to say a young adult, but he's 32, so I think that ship sailed, of an adult with autism. Little Star was the first ABA center in the state of Indiana, and it is a not-for-profit. We were providing ABA services before insurance was even paying. And I just wanted to speak to you today just as just a mom and somebody who has, been working with people and families with autism in their lives for over 20 years. And I just wanted to remind you that ABA is not a home and a community-based service. ABA is a medically necessary intensive treatment. ABA is a medical diagnosis, not an educational diagnosis. Center-based programs for children with autism are the most intense, robust way to deliver ABA therapy and to get these kids ready to go on to the next level. If you think about autism, you have children who a lot of times prefer to be alone, don't want to go out and try new things. If we offer their services in their home, they're alone with just one person during the day. We need to stretch them. We need to get them into the centers, get them used to other kids, loud noises, because that is how we successfully transition them into the schools. And I know I speak for all of the providers, why we love our kids that are at our centers. We don't want them with us forever. We want to move them to the next spot, which would be to transition them to a less restrictive setting. But in order to do that, we just can't keep them in their home. And when you also think about it, 50% of people with autism, children with autism, are nonverbal. So if you have a nonverbal child in a home, with their parents might not be there, alone with a therapist, or just somebody working with them, that really opens the doors to abuse and neglect. And in a center situation, there's so many supervisors around, there's so many parents around, it's a much safer environment for our children to be in, and a much more robust environment for our kids to learn, to grow, to stretch, to get comfortable, so we can move them out into the community and into the schools. The average rate that was determined was $97 an hour that providers were charging in the state. And going back to a rate of $68 an hour is really just the average cost of doing business. So it's really hard to stay in business when you're barely breaking even. And there are so many sunk costs that we have in ABA. Training, we have to get them certified, recruiting, all those things we're never able to recapture if we're, just barely breaking even. So I would ask this committee to consider the higher proposed rate as opposed to the $68 an hour, because this rate will force many centers out of business. It will force many centers to not accept Medicaid children at all, and then these children will be forced into the school district, and the schools are just not able and equipped to handle the intensive needs of the children with autism, because again, it's a medical diagnosis. It's not an educational diagnosis. So thank you so much for your time. I appreciate your attention, and thank you so much for what you do.
Any questions?
Thank you.
Thank you.
Hello, thank you for the opportunity to speak with you today. My name is Michelle Trevetti, and I am a constituent from Westfield, Indiana. I'm a parent of a child with autism. I'm also a health services administrator and have worked in healthcare. I like to joke I've worked in healthcare since I was 8 years old, helping run my dad's practice and then moving through the ranks of health administration in the ambulatory setting. Over 20 years ago, I was lucky to be involved with the parent group that successfully advocated with the Indiana General Assembly to pass the nation's first and most clinically sound autism health insurance coverage law. And my daughter Ellie was the test case for implementing that law. The law had unprecedented bipartisan support because wisely, the legislators understood that the law was not so much to mandate coverage as it was to address discrimination against people with autism within the healthcare industry and the insurance industry, and to allow them to access the type of care that many other conditions were able to access. The legislators understood that access to quality ABA would prevent further disability, would reduce special education costs, and would also reduce the overall healthcare costs for this population. It would give people with autism and their entire families more equal opportunity in health, education, and in their work life. Now Indiana Medicaid is pursuing a reimbursement level and coverage limitations that will turn the clock back to the days like before the autism mandate law, when only wealthy families could access ABA. When my daughter started ABA, the only families that were able to access ABA were families like mine, a physician's family, a lawyer's family, a businessman's family, people with six-figure incomes. After the autism mandate law was passed, and then with the addition of the ABA Medicaid medically necessary benefit under EPSDT in 2016, now we see public school teachers' kids accessing ABA. We see policemen and we see firefighters' children accessing ABA. The current proposal from Medicaid will turn the clocks back to when those families could not access ABA. Only families that are able to afford to have one parent stay at home with their child will be able to access ABA if it is limited only to home therapy. This will also disproportionately hurt people of color, rural families, and families that live in apartments or rented homes that just simply are not big enough to support being an all-day therapy center at home. Providers will start to favor privately insured families over Medicaid-insured families due to these added barriers and constraints. Providers will limit the number of Medicaid patients they see, or they may leave the Medicaid networks altogether because they will have to. Indiana's proposed rate does not adequately cover the costs of providing this labor-intensive therapy that is typically one-to-one staffing. But sometimes, in cases like my daughter, there may be double or triple staffing that is needed for an individual temporarily in order to address very serious behaviors such as self-injury, aggression, and property destruction. My daughter suffered from these behaviors over 100 times per day for over 5 years. She punched out the microwave glass door in our kitchen. She put holes in our walls with her head. She left bite marks up and down her arms and mine. Without having ABA fully covered by her insurance for those 5 very long, very difficult years, she would have lost her opportunity to attend the public school because they could not handle those behaviors and shouldn't have to handle those behaviors because those behaviors need to be treated medically. She would not have been safe in her home. We would not have been safe in our home without ABA therapy. She never would have learned the volunteer and vocational skills that she learned in high school. She would have experienced very expensive and ineffective cycles of repeated short inpatient stays and repeated emergency room visits that were not designed to address the core behavioral issues at the center of autism. Most likely, she still would be having these very serious behaviors because medication alone does not work without behavioral intervention. Instead, she received both medication and quality ABA therapy, both in our home and in a center. That was at a fraction of the cost of what the alternative was, those repeated ineffective cycles of inpatient treatment and ER visits. Because she had access to ABA therapy, quality ABA therapy, today she's 26 and we have a wonderful family life. She loves her day program, she loves her dogs, she loves to travel, and she loves to go to rock concerts. I am in my second year at law school, and I'm working in a job that I love. When she was diagnosed, I had to give up my profession, and I had to give up my educational opportunities to make sure that I could oversee our home therapy program for the first few years until she was able to get into a center-based program. Now, I am not forced to stay home and be isolated and forego those opportunities for myself and my family. My husband is an emergency physician. It's a very stressful job, and he takes care of our community every day. He's told me a number of times that would not have been possible for him to stay in such a stressful job if it weren't for access to ABA therapy. Under Medicaid's proposal, many ABA providers will refuse to take the tougher cases like my daughter. And these are the very families who need ABA the most. These are the very families that will end up in a repeating revolving door of going in and out of the hospital and going in and out of the emergency room, and that will not do anything to improve that person's autism or that family's life. It will just cost the system money. I have been an autism advocate for over 20 years. I've spoken to hundreds of policymakers and managed care entity administrators, and very precious few of them truly understand what ABA is and how it is appropriately and effectively delivered. I want to thank Lieutenant Governor Crouch for taking the time to visit a quality ABA program and to see for herself what quality ABA looks like. I urge all state policymakers to take an hour, just an hour. You can come see my daughter's program. I personally invite you to. Take an hour to take a look at an ABA program and see what an incredible investment it is in prevention and what an investment it is in the people that ABA therapy centers serve, and what an investment it is in their families and in the community. We are only beginning as health administrators and as health policy advocates to understand the across the lifespan savings from ABA in reduced need for health care, special education costs, and reduced need for more intensive waiver services for our loved ones. And we are even worse at understanding the health and economic impact upon the whole family of the person with autism. One small example, just to show what this impact can be. It used to take 5 dental care staff people and sedation to accomplish a routine cleaning on my daughter's teeth. 5 people, twice a year. Exposing her to anesthesia and sedation twice a year. She did a 6-week ABA dental boot camp at her ABA provider center. For the past 15 years after doing that boot camp, she now has her twice per year cleanings and x-rays in a regular office visit with just the dentist and just the dental hygienist, all because of ABA desensitization programming. She is being saved from not having to be exposed to the risks of anesthesia twice a year, and her insurance in the state is not paying for anesthesia, OR dentistry twice per year. That adds up to thousands of dollars for just one person. Imagine if everyone had access to that. Please do not make the mistake of taking Indiana backwards to when people with autism had few options for effective treatment unless their family was wealthy. Please do not make the penny-wise, pound-foolish decision to restrict ABA to home locations and to reimbursement schemes that are sure to exacerbate the already existing health equity issues among that population and in Indiana. Thank you very much for your time and attention, and if you have any questions as a parent, please let me know.
Questions? Thank you.
Thank you.
I don't believe anyone else has signed up. Does anyone in the audience? Oh, has
I
someone
was
else
looking
signed
at
up?
Christina to see if we had
No
anyone
one,
else.
is anyone else in the audience care to comment? Is there any discussion among task force members? Kim, looks like you want to say something.
But I don't know, I mean, I don't know discussion. I think from the Arc of Indiana's perspective, we absolutely stand behind all the words that were just shared by the people who just spoke. We are very concerned about the impact that the proposed rate is going to have on families. I can tell you personally, I'm not overly concerned about those providers that moved into our state to specifically take advantage of the lack of system that Indiana had, and if they move away, that's fine. What I do hope does take place is those providers, such as Little Star, who have been in this with us since the very beginning, I hope that they're able to make do and take advantage of other providers leaving and still be able to provide services to those families. I think anything we can do as a panel to urge the Office of Medicaid to reconsider their proposed rate is what we need to be doing. I think the proposed rate is too low. If the average rate is 97 and they are only proposing 68, a nearly $30 cut is pretty significant, and we are going to see very drastic changes in this programming, which is very important.
What would be a reasonable amount, do you think?
Well, I think the one thing that we really need to consider is how they came up with the administrative percentage. And I think as much as the Arc of Indiana is supportive and we go after home and community-based services, we really need to recognize that that does not include ABA. And so I think tying the administrative rate to those type of services is the wrong thing to do. I think that itself really needs to be higher, which would then, again, boost up that average fee. I think if the average is 97, I don't know what would keep us from at least doing the 97 at first. While this rate study is going forward, that would potentially back us down to an amount. So I would think that it has to be either close to 97 and much higher than 68. Sorry, it's not an exact number.
Any other comments? Yes, Representative Clear?
Thank you. I'm just curious, we're talking about the average being 97. Do we know what the median is? Because my understanding has been that there has been a lot of variation in rate, right? I mean, there are some extremes, so I'm interested in understanding what the median rate has been, and I think that might help inform the conversation. We certainly don't want anyone to lose access to therapy. I'm also interested in learning more about how the amount of therapy is determined. There's been some conversation in the State House recently about 40 hours being quote unquote the gold standard. And I want to make sure that we're focused on what's appropriate for each child. So I'd be interested in learning more about that and also learning about the median rate.
Anyone? Good question. If anyone in the audience has any comments on that or any response, can you come to the microphone, please? Thank you.
Hi, my name is Jason Shaw. I'm the current president of NP. I would just say that as the data has been presented to us, that average is an average by building, by location. So a provider that has 3 locations versus a provider that has 20, it's by location. So the average isn't necessarily tied to per unit that's been billed, per each child, or per hour. It's the average rate that that building bills at. So we haven't had anything more granular than that shared. Is that accurate? Yep.
Thank you, Representative. I wanted to address your question about dosage. Obviously, I'm not a clinician, but I've been an autism health insurance advocate for the last 20 years. And throughout the process of implementing the Indiana Autism Mandate Law and also the 2016 autism benefit under Medicaid, there was a lot of discussion about dosage and a lot of discussion about comparing Indiana to other states. And as I have been for the past 20 years, I've been cautioning policymakers to be careful about comparing Indiana to other states because for many, many years, Indiana was the only state in the nation that had a coverage policy that did not arbitrarily limit access to ABA therapy to a certain age group or to a certain predetermined number of hours and or didn't basically put those artificial limits on there that didn't really have anything to do with medical necessity. So if you do compare Indiana, say, to Tennessee or to another state that had those artificial caps on treatment, Indiana will look more expensive, but not because of anything other than there were these artificial caps on therapy. So we have to make sure that when doing those cost comparisons, it's an apples to apples comparison. And again, like you said, what I've always advocated for is medical necessity by the individual. A person like my daughter who has very severe self-injurious behaviors may need 60 hours of ABA a week, and she got 60 hours of ABA a week, not forever, but for the time that was needed to reduce those behaviors, get her back in school, and for her to be safe. And now I think she's doing 15 hours per week. And so what we really advocate for is an individual dosage and to be very careful to take other states' caps and apply them to Indiana as making us look like we're too expensive or doing the wrong thing when clinically that is the way to do it is individualized. So thank you for the opportunity to address that.
I can just share some data from Little Star. We have 5 centers across the state, and the way our dosage breakdown works, it really is a third. 1/3 of the patients we serve get 20 hours or less a week. Another third get between 20 and 30 hours a week, and then another third get between 30 and 40 hours a week. So, not every, autism is a spectrum, and not every child needs to get 40 hours a week. So it's based on, their needs, their evaluation. We have many kids that come to Little Star half a day and go to school the other half a day. So it's not 40 hours for everybody because it's not meant for everybody. I can just tell you, like my son, he gets 9 hours a week of therapy and continues to make progress, but he's older. So, thank you.
May I ask a question while you're at the microphone?
yes.
I guess a concern I have is that those without means are not going to get the same services as those that have means are. And that's a reality, but we certainly don't want to take action that really adds to that. So in your client mix, what percentage is Medicaid reimbursed, and then what percentage is private pay or insurance pay?
Yeah. Yeah, so this is, he knows it, he can tell you those numbers.
Primary Medicaid, we're looking at about 52 to 53% of our patients have Medicaid. Yeah. So.
And just one more comment. I think, like most centers, we don't we at Little Star, we don't prioritize. Somebody gets on the waiting list and they come in. We do not cherry pick and say, well, this kid's Medicaid, so he gets pushed back on the list. This child is, private pay insurance. We're going to give this child a spot sooner. Everybody just, and I think I would say most centers are like that. We just take the children as they come to us. We don't prioritize them by what kind of insurance they have.
So if someone is not, if the reimbursement rate doesn't meet your cost, then what happens? At some point in time, you say, we're not going to take any more Medicaid?
Yeah, I think at some point in time, we'd have to look at our payer mix and see how many of these kids can we afford to take? And, right now, we're at about, a 50-50. But if we were going to lose money on it, we'd have to be very careful and say, okay, maybe our mix now is only 10% Medicaid. We would have to make those hard business choices to keep our doors open.
So you all have made public comment. What do you see as the solution?
I think a rate that is fair, that can keep the good actors in business. That's a fair rate where we can serve the children with quality and make a little bit of margin on it so we can stay in business. And the other people that don't like the rate are going to leave, are going to pack up and, leave the state. We know of a provider recently who just packed up all their centers and left the state of Colorado because Colorado said their rates were too low. And so I think that we will see that in Indiana too. I think we will see some providers, close down or just not choose to serve Indiana anymore. But I think the people who are committed to Indiana, who are here in Indiana, who are, Hoosiers and are here for the kids will make it work.
Thank you.
Yeah, thank you.
Any other comments by committee members? Well, thank you all for being here. That concludes our public testimony. We have 25 minutes if everyone wants to get up and find a warm place to be in.
Thank
We'll be-
goodness I have my handy dandy jean jacket.
We'll be back at 2 o'clock for our regular meeting. Thank you.
It's always, and then I'll shut the door to my office and I have the window from the hot.